Joel Embiid has a torn lateral meniscus, leading to, of course, a lot of concern and confusion about what's going to happen with the 76er star. And we're going to try and simplify it and explain it in better detail here in this video. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you about the medical side of the sports world. Here's the tweet from Woj saying that Embiid has been diagnosed with an injured lateral meniscus in his left knee, will be out through the weekend while a treatment plan is finalized, and then further went on to clarify that there's a lot of uncertainty about how the medical staff, outside specialists, and Embiid are going to move forward with what they do. This is all really, really important, as we'll talk about with some of the minutia with how we handle and manage meniscus tears. But first, I want to go back to start everything with this play, because everybody's getting a little bit caught up in, is his meniscus injured? Did he tear it? Was this the moment when the tear occurred? And I think that's really important. It sounds like we're splitting hairs, but that's extremely important to think about when the tear occurred in terms of how we manage it and how we consider this. So this, of course, was the play when Embiid eventually had to come out of the game. And again, I don't think that this is when the tear occurred. I don't think if you go 30 minutes before this play that he had a completely normal meniscus, and then boom, on this play, the meniscus tore. Number one, there's no axial load going up through his foot. He's not loading it. He's not bending and twisting. All that's happening is somebody is landing on his knee and it's hyperextending it. But again, we talked about how this isn't really hyperextending. It's just getting him back to a more neutral position where, yes, depending on his range of motion, this might be more than the soft tissue on the back of the knee can handle, but this shouldn't like extend the joint enough to cause significant bone bruising or a new injury. So no, I do not think that this play injured Embiid's meniscus. Now, this play could have certainly aggravated a meniscus, and in fact, one of the physical exam tests that we'll do for meniscus tear is something called a bounce home test, where you take the knee, you initially have it in some flexion with it bent, and then you sort of slowly go into extension, and you're trying to take, if you imagine the joint, you're trying to take the more front anterior portion of the meniscus and sort of knock it together to just see if you can irritate any potential tear whenever you go from neutral to a little bit extended. So in a way, what's happening here on Embiid is sort of like a bounce home test to potentially irritate the meniscus. So this very much could have irritated an already torn meniscus, but I don't think this caused a new meniscus tear to occur. And we'll explain again, I promise, in detail why all that matters. Next, we're going to take a look at the meniscus anatomy, how we treat these, this distinction between old versus new. But first, I want to give a shout out to the sponsor of this video. This video is sponsored by Ada. Did you know that there are now treatments available for COVID-19? Yep. And that means if you catch it, there's something you can do to potentially avoid getting really sick. COVID-19 is still a very real risk in our world, and during these winter months, cases can certainly be on the rise, especially as we're spending more time indoors. And that's why it's important to know that you or your loved one could get treatment for COVID-19 if needed. All you have to do is take Ada's free health questionnaire to see if you're at high risk for developing severe COVID-19 infection by clicking the link in the description below. Their free health questionnaire walks you through a series of steps that gets information about you and your health to help them determine if you're potentially at high risk of developing severe COVID-19 and might benefit from specific treatment if eligible. If eligible, you get connected with clinicians in telehealth to learn more about COVID-19 treatment options. Taking care of your health at the start of the new year is just a really smart move. Ada's free health questionnaire is trusted by clinicians to help you understand more about COVID-19, and I can't stress enough as a doctor the importance of proper COVID-19 treatment. I trust Ada to help give you and your loved ones that guidance here at the start of the new year. Thank you again to Ada for sponsoring today's video, and let's get back to our learning. So let's take a quick anatomy lesson here. Of course, we're looking at a left knee. The menisci are going to be these two C-shaped pieces of cartilage that sit inside the knee. There's one on the outside, the lateral meniscus, and then one on the inside, the medial meniscus. If we hide some more of these structures here so that we can ultimately look kind of from top down at these tissues, we'll get a better look at what these exactly look like. So here we have those two menisci. If we zoom in here, this is the one lateral on the outside, and then we have the medial on the inside. The meniscus get their blood supply from out to in, and so the blood supply starts at the periphery and then works its way inward on both sides. This is important because whenever we talk about the ability to repair versus resect a meniscus in surgery, a lot of it depends on the blood supply to the torn area. So if you have a tear that's, say, down here in a poorly vascularized area, it might not be as amenable to a repair because there's not going to be as much healing potential versus having a tear out in the periphery with much better blood supply. There's more ability for that tear to heal. In general, the two things that they're probably considering with Embiid are, do we need to do a surgery now or do we not need to do a surgery now? The fact that they're taking time to think about this means that it is not some big, major, severe displaced meniscus tear. Some meniscus tears, when you see it on the MRI, are clearly so torn that you know you need to do a surgery. And you know you need to do a surgery because you won't be able to adequately treat it later on. That doesn't seem to be the case with Embiid, because we would have probably found that out. You wouldn't need to go to multiple specialists to make that determination. What they're probably trying to decide is, how do we manage this in terms of, do we need to do a surgery now? Can we give him some time? Can we let him try to play through this? How is that going to affect things long term? So the fact that they're taking time to decide is, I think, a good thing. Now, meniscus tears. We've got to talk about this because it's really important, especially in a high-level athlete. Embiid, number one, has already had surgery on the meniscus in the left knee. I don't know if we know if it was the lateral or the medial, but anytime you do surgery, you're going to remove part of that meniscus, potentially in his case. And so what that does is it affects the rest of the meniscus and can put you more at risk of having future problems with that tissue. If you take a large population of NBA players and you get MRIs on their knees, especially bigger guys like Embiid who have had previous surgery, you're going to find torn meniscus tissue in a high percentage of them. That doesn't mean that it's symptomatic. And so the challenge with Embiid is, they see a meniscus tear on the MRI. Does it mean it's actually symptomatic? And so they'll base their physical exam, they'll correlate where he hurts with what they see on the MRI to make that determination. But it is very possible, in fact, I'd say it's probable, that that meniscus tear has been in Embiid's knee for a while, whether or not it was causing any symptoms. It's not like they mismanaged it, because again, a lot of basketball players and professional athletes are going to have abnormal tissue in their cartilage and their meniscus where you could find something to call out as not being 100% normal. But remember, with meniscus tears especially, there is so much variation in tear pattern and tear severity. You can have just a slight little area of fraying. You might have this big flap, unstable bucket handle tear. You could have a complete root avulsion. There is so much variety in meniscus tears. This is why orthopedic surgeons get paid the big bucks, because you've got to be able to decide what's a true new symptomatic tear, what's sort of expected activity related result of previous surgery injuries. And so in Embiid, I suspect this tear has been there for a while. Whether or not it was symptomatic before and became symptomatic recently, I would say most likely. But it's not like there was a big tear that the Sixers medical staff missed that just now they're appreciating. This is a very, very expected, very normal sequence of events that's part of being a high-level athlete. You have these aches and pains, you have these abnormal findings. The medical staff just has to understand how to appropriately address them. If they decide on surgery, we're looking at either a meniscectomy, which is resection of the torn tissue, or a repair. A repair would put Embiid out for the rest of the season. A meniscectomy would allow him to come back in probably somewhere around 4 to 6 weeks, best case scenario. The other possibility is, if there's a tear, you can potentially try and play through it, and then you address it at the end of the season. The challenge with that is, if it's a tear that could currently be repaired, ideally you want to repair the meniscus for the long-term health of the athlete. If you continue to play through it, you could make that tear worse to where then you can't repair it after the season, and you're doing sort of an inferior surgery long-term by just cutting out the torn tissue. So there are a lot of factors at play here, but not anything that necessarily is, number one, shocking or like an, oh no, this is terrible moment. It doesn't surprise me at all that they found a meniscus tear on his MRI, like I said in my initial video. But there's just so many variables in terms of how big, is it old, is it new, can it be repaired, does it need to be repaired, that go into play here, that I don't think Sixers fans should be all doom and gloom just yet. It's very possible they say, look, we're just going to rest him for a couple weeks, do an injection, let him try and play through the season. Or they might say, you know what, he's going to miss a month. We're going to go in there and treat it right now, and all we can do is cut it out. Yes, there's a very real possibility that they say we need to do surgery, they repair it, and he's out for the season. But that's not a certainty based on what we know so far. So that's it for the video. I hope this was helpful. Meniscus tears, while they might sound simple, can be one of the most complex surgical decision-making management scenarios, just because of how commonly they're going to be incidental in an athlete like Embiid, and just the variety and location, management, etc. So many factors here. But I don't think they have necessarily been screwing something up with what they've been doing. It's normal for players to have bumps and bruises here and there, have pain here and there, and until it really declares itself as more obvious, you might not do that MRI. Let me know as always any questions or comments down below. Thank you again to Ada for sponsoring this video, and until next time, we'll see you later.